morning. Today we are to discuss new topic, general anesthetic. Anesthetics. You know the anesthesia. Anesthesia means loss of consciousness. Loss of consciousness. That is anesthesia. The anesthesia you will be divided in the local anesthetic, and the anesthesia may be two parts. Local anesthesia and general anesthesia. The local anesthesia, it's a reversible loss and applied restricted part of the body. Restricted part of the body. And reversible or regain. But the general anesthesia, you discuss now general anesthesia. Now definition of general anesthesia. General anesthesia means a drug which produce reversible loss of consciousness and sensation and sufficiently complete to allow surgical operation are called as general anesthesia. See the definition again: a drug which produce reversible loss of consciousness and sensation also loss, then they allow to complete surgical operations, then are called as the general anesthetic. General anesthetic generally used for the big surgery. Okay. Now the mechanism of action. Mechanism of action. Mechanism of action of general anesthetic is not precisely known. Exact is not known, then generally this action is by stabilizing stabilization of the nerve membrane with a resultant drop in the amount of transmitter released by the nerve impulses and depression of post synaptic transmissions there are various theories to explain this action of anesthetics. See, exactly the mechanism of action is not known, it precisely is not known, but generally these are the theory. The general anesthesia stabilize the nerve membrane, stabilization of the nerve membrane, and the resulting drop of amount transmission and release by the nerve impulses. Then they depress the post-synaptic transmissions. They produce the loss of consciousness and loss of sensation. It should be reversible loss of consciousness. Reversible loss of, you are again conscious. Reversible loss of consciousness and the sensations. Now they are formed. These are the various theory. This theory always asked in the annual examinations. Now the first theory, the lipid theory. The lipid theory. In this theory, it is stated that the anesthetic dissolve in the nerve cell membrane causing the membrane to swell, causing the membrane to swell. This alter the crystalline structure of the cell membrane. The crystalline structure of the membrane and disturb the membrane function. In the lipid theory, stated that the anesthesia dissolve nerve membrane nerve cell membrane, and that they causing the membrane is swell. Membrane should be swell, and after that they alter the structure of membrane, and then they change the membrane function. That in this happen in the lipid theory, and they produce the general anesthetic effect. Okay, now second theory. Hydrate theory. According to in this theory, anesthesia frees water molecule in the form of anesthetic hydrate complex close to the surface of the nerve membrane, and thereby impede the opening of sodium channel. That impede the opening of channel, they can obstruct the opening channel. According to this theory, hydrated theory, according to this theory, the anesthesia frees the water molecule in the form of anesthetic, and hydrated complex close to the where in the surface of nerve, and thereby they impede obstruction to the opening of that channel, and they produce the effect. Now the next theory, protein theory. In this theory, it should be the postulated, that is a assumption postulated, that anesthetic bind to the hydrophobic site of protein molecule of the neuronal membrane, and alter membrane function. The protein theory is postulated the anesthetic bind to the which side, that is that side should hydrophobic side of the protein molecules. Anesthesia bind to the hydrophobic side of protein molecules, so they have affinity to the protein. That side bind to the protein and the neuronal membrane, and they alter the function of membrane functions should be altered, and they produce the effect. Now these are the most important three theory. First theory is the lipid theory. In the lipid theory, you know it, anesthesia dissolve in the nerve membrane and causing swell the membrane, and they alter the function of membrane. Okay. Now second theory is hydrated theory. Anesthesia is a freeze in the water molecules the anesthetic in the form of anesthetic. They form hydrated complex on the surface of nerve and they alter the functions, and then they obstruction to the opening of sodium channel there, that may be called the impaired of the opening channel of sodium. Routine theory is a postulated theory that anesthesia bind to the hydrophobic side of the protein molecule on membrane, neuronal membrane, and they alter the function of membrane. Okay, now next topic. This topic also important: sign and stages of anesthesia. Now, after given the anesthesia, how you can understand the stages of anesthesia? You can check. They are commonly observed respiratory movement. Now, in these sign and symptoms, sign and the stages of anesthesia, there are various methods to judge the proper surgical anesthesia, but common method include the following observation. After given the anesthesia, and then you can observe first respiratory movement. Respiratory movement, eyeball movement. Next, size of pupil. Next, eyelid reflex. Now these are the following observation you can observe. First, after administration anesthesia, check the respiration movement. It should be constant and up and down and forward. See the eyeball movement. It should be rowing or not rowing or fixed in the eyeball. See the pupil size, maybe dilate or contract, and eyelid reflection. These are the observations you can watch after the administration. On the basis of that, induction of anesthesia can be divided into 4 stages. After induction of anesthesia, the stages is divided into 4. The first stage, important stage of analgesia. In the first stage of this stop coming. The stage of analgesia. This stage began with start of administration. This stage begins start of administration of the anesthetic and lasts until consciousness is lost. During this stage, the patient is conscious and drowsy. He obeys the command. He obeys the command and feeling of pain lost. Reflex and respiration remain normal. Okay, now see the again stage of anesthesia. In this stage, administer the anesthesia up to till loss of consciousness. What happened in that phase? During the stage, the patient is conscious and the drowsiness. Okay, you obey the command and feeling the loss of pains and remaining reflex and respiration in normal. See the patient went into OPD, operation theater. Doctor is start the operation procedure. Before that is administered the anesthesia. That is the first part of anesthesia. And then administer the anesthesia. He asks your name, address, what are you doing, all this. You can say all these things, and slowly is loss of your consciousness, and you obey all the commands. And that stage, during that stage, pain is lost. Reflex and respiration is the normal. Then second stage of excitement, important stage. The stage of excitement. In this stage, begins with the loss of consciousness and extend to the level where surgery is possible. In this stage, the patient is excited, and there may be increase in voluntary movement voluntary activity, that is involuntary activity is increases. Involuntary activity, those activities should not control our will, that activity, those activity going on automatically, that such activity is increases, and in this stage the patient see the loss of consciousness and extent allow for the if possible the surgery is level is extended, surgery is possible, then patient is excited, and thereby maybe the increase the that movement it should be goes the automatically, it should not control the wills, the pupils dilated, the pupil size dilated side may be the increase, pulse is rapid, pulse is rapid, fast and strong, blood pressure may rise, blood pressure may rise. So these are all the activities goes in the involuntary activities. No operation is carried out during the stage. No operation carried out during the stage. Okay, now see again the second stage very briefly. Stage of excitement. In this stage is begin the loss of consciousness and extend to the allow for the surgery, some extent level to the. In this stage patient is excited and they increase the involuntary movement activity such as dilate the pupils, pupil size may be increased, pulse should be the rapid, fast and the very strong, blood pressure may rise, and no operation carried out during the stage. And the third stage, stage of surgical anesthesia. This stage is extend from the onset of regular respiration to cessation of spontaneous breathing. Spontaneous. This stage is further. This stage is further divided into four planes. Okay, the Now the plane first. Moving of the eyeball. Movement of the eyeball fast. Pupil size normal. Respiration normal. And the plane ends, I become fixed, and plane end, I become fixed. Plane 2, corneal and laryngeal reflex are lost. Laryngeal reflex are lost, and eyeball are fixed. The plane 3, pupils start dilating. Light reflex are lost. Blood pressure starts failing, and intercostal muscle are slowly paralyzed, and intercostal muscle is slowly paralyzed. Plane 4, intercostal muscle intercostal muscle paralysis. Shallow abdominal respiration. Abdominal respiration. Dilate the pupils. Low blood pressure. Then see again stage 3, the stage of important stage, surgical anesthesia. This stage is extend from onset of action, regular respiration to the cessation of the spontaneous breathing. Regular goes to the spontaneous breathing is take place, and then they are divided into 4 planes. In the first plane, roving the eyeball, movement is increased, pupil size is normal, respiration normal, and plane become end, the eyeball is fixed. Then second, corneal and the laryngeal reflex are lost, eyeball are fixed. And the third plane, pupil are dilating, light reflex loss, blood pressure start the failing is fall down, intercostal slowly paralyzed. Before they are intercostal muscle are paralyzed completely, and shallow abdominal respiration. The respiration should be the shallow abdominal. कम जाता. Then dilated the pupils and low the blood pressures is happen in the stage of surgical anesthesia. And the fourth stage of medullary paralysis. The patient pass into this stage excessive in this stage excessive administration of an anesthetic agent. Anesthetic agents. In this stage, completely failure to the respiration. Complete failure of respiration. Pupils dilated, followed by hypotension and death. This stage can be observed with drug like ether, which induce anesthesia slowly. This is the last stage. In this stage, the excessive administration of anesthetic agent, then completely failure to the respiration, dilate the pupils, and followed by the hypotension and the death. In this stage, drug like anesthesia is induced very slowly. They are not rapidly, they are given very slowly, and they produce the effect. Now, important point: pre-anesthetic medication. Anesthetic medication. Before admission to the anesthesia, such agent is given, that is called as the pre-anesthetic medication. They are most useful. The drug administered prior to the general anesthesia are called pre-anesthetic medications. Why they are given? Mainly they are given, right? These are used. These are mainly use first to decrease anxiety, tension, worried, they can decrease, to facilitate smooth and rapid induction of anesthesia. Smooth and rapid induction of anesthesia. Okay. Third, to reduce the side effects of anesthesia. To reduce the side effect of anesthesia. Like salivation, those are doing obstruction during the surgery. Bradycardia, blood pressure should be fall down. Vomiting, fourth, to relieve the post operative pains. The sum of the common drug used for this purpose, sedative, hypnotics and anti-anxiety agents. To decrease the anxiety, the drug are used such sedative, hypnotics, and anti-anxiety agent. Example: benzodiazepine, barbiturates. These are sedative and hypnotic drugs. Diazepam, reduce the anxiety. Okay. Promethazine, before the anesthesia is given by tensions is releases such drugs. Okay. Opioids are used for the post-operative pains. After the operation, pains is unbearable, such pains is bearing, use the opioid drugs. Morphine, pethidine, this is a synthetic derivative of morphine, is commonly used the post-operative, most common the gynec unbearable pains in that. Third, anti-emetic, droperidol, cyclizine. Okay. Now these are the drug is prevention the vomiting. And fourth, anticholine, anticholinergic drug, that is atropine, that reduces the salivation. Hyoscine, these are reduce the salivations. This is salivation. Such drug are used before the anesthesia. basal anesthesia. Next point 5. Basal anesthetics. The anesthesia used for short-term anesthesia used for short of surgical anesthesia are called as basal anesthetics. The agent are used for this purpose, that is called as the agent used for this purpose is called as basal anesthetic. These are commonly used for the nervous patient and hyperthyroid patient. The agent used are thiopentone and benzodiazepines. Okay. Stop.